Hi, my name's Steve Moran. I'm a professor in the Division of Hand Surgery here at the Mayo Clinic in Rochester, Minnesota. And I specialize in wrist surgery as well as hand and thumb arthritis. I'm here today to talk to you about new options in the treatment of thumb arthritis. Thumb arthritis is very common and can affect up to 75% of women that are postmenopausal. It's a joint that moves in many different directions, and so it's at great risk for injury in the development of arthritis at an early age. The joint that's affected primarily in thumb arthritis is just below the metacarpal bone, and this is called the carpal metacarpal joint. This bone and joint is shaped like a saddle, and so it has a broad surface that can become affected by arthritis. Patients usually present with significant thumb pain after repetitive activities or when they're trying to squeeze or open jars is a common complaint. We usually make the diagnosis based on physical exam and also by looking at your x-rays. The treatment of thumb arthritis is initially focused on managing your symptoms and helping you do activities in a simpler way that places less stress on the thumb. We usually start with splinting and resting the thumb, treatment with nonsteroidals like Advil in order to control your pain. However, if thumb arthritis advances even with these non-surgical options, we then can consider injections of either steroid or hyaluronic acid, and only after all of these methods fail do we consider surgery. There are several different options for surgery. The most common is to remove the bone entirely, and that would be removal of this trapezial bone. There are several different options of what to put in place of that bone. Some of it may be scar tissue that your body forms. Other surgeons perform a surgery where they place a portion of a tendon within that space. And today we're here to talk to you about replacing part of that joint in order to save that bone. The benefits of preserving the joint may be increased range of motion and improvement in strength by saving the bones that are there. The Mayo Clinic, what we do is we replace half of the metacarpal bone with a substance called pyrocarbon. Pyrocarbon is a special form of carbon that has an elastic modulus or strength that is equivalent roughly to the outer surface of normal bone. This half a joint replacement, or what we call a Hemi Arthroplasty, functions like a ball within a socket within your native trapezium and allows the thumb to move through an almost normal arc of motion. The surgery takes about 30 to 40 minutes and involves making a small incision over the back of your thumb and then removing the end of this bone. The area of the trapezium that's involved with arthritis is ground down to create a shallow cup, and then the pyrocarbon implant is inserted into the base of the metacarpal and then is placed within the socket in the trapezium. This forms a stable fit. At that point, the soft tissues around the thumb are closed and you're left with an incision that is roughly 2 centimeters long. You're placed into a cast for 2 weeks. Following that, you're taken out of the cast and placed into a soft splint, and patients usually can begin range of motion exercises and rehabbing the thumb at about 4 weeks after surgery. Many patients are able to return to regular activities as soon as 6 weeks. We've had very good results with this implant here at the clinic, and we've been performing it now in patients for over 8 years. There are other options that your surgeons may offer you. In long-term outcome studies, all surgeries for the thumb tend to have the same outcome and produce good results in most patients. If you have further questions with regards to thumb replacement surgery, or if you have other questions in general about thumb arthritis, we encourage you to ask your doctor or to call us here at the Mayo Clinic. Thank you.